Well, welcome to Dare to Be Authentic podcast. I'm your host, Maury Mitchell, and I have a very special guest today. I'm so excited to have to talk about sleep apnea, a really interesting subject. People don't know a lot about it. His name is Dr. Payam Haghighi, also known as Dr. H to his patients. He's a dentist who's passionate about helping people breathe better, sleep better, and feel better. Along with general and cosmetic dentistry, he focuses on airway and sleep apnea, especially in kids. He loves digging deeper to find the root cause of issues and helping patients live healthier, more energetic lives. Welcome to the show, Dr. H. It's great having you here today.
Thank you. It's great to be here. Thank you, Mary. And I appreciate your time.
Awesome. So let's talk a little bit about what inspired you to do what you're currently doing.
Of course. So, hello, everybody. As Mary mentioned, my name is Dr. Payam Haghighi, but most folks just call me Dr. H. I'm a general dentist, but I got super interested in why some people have bite problems, issues with their jaw joints, which are called TMJ, and why veneers and crowns sometimes don't last. So to get a better handle on all of that, I went to the Dawson Academy and learned a ton about being a better dentist, right? So, but during my training, sleep apnea, sorry about that. So sleep apnea kept popping up. So like, hey, you got to make sure the patient doesn't have sleep apnea. You got to make sure if the patient, especially when they are grinding. So it hit me that the sleep apnea can really mess with dental work and cause things like veneers and crowns to fail.
Mm.
So that got me really curious. So I decided to learn more, specifically about how to diagnose, fix, or manage sleep apnea. The more I learned, the more I realized how important it is and how much I wanted to help people with it. What really inspired me was seeing the profound impact that better sleep and airway focused dentistry could have not just on smiles, but on people entire life. One of the experiences was like a 3 years old girl who was grinding her teeth at night and struggling with behavior and focus during the day. We placed her on a sleep appliance. It's a very simple one, just a plastic block to sleep with it. And just a couple of weeks later, her daycare teacher told her mom that the behavior had drastically improved. She was sleeping better, focusing better, learning faster, and her whole personality began to shine.
That's amazing.
Now, now, yeah, that's reminded me actually of my own daughter. She used to have nightmares, restless sleep. After starting similar treatment, we saw massive improvement. Not only her sleep got better, behavior and academic performance got better. And to be honest, I was my own first patient for years. For years, I was always like, uh, tired during the day, clouding in my mind. I mean, I was getting 8 hours of sleep, but I was still tired. I couldn't figure it out.
Mm.
I had frequent throat infection when I was younger. I was snoring at night. And once I learned about the sleep apnea, everything clicked. I realized that I had it. And then I saw it on my daughter, my wife, my mother-in-law. My whole household was affected. The personal discovery changed the entire course of my practice.
Wow, that's amazing, especially about that 3-year-old. That's who
Yeah,
would think that that's what causes behavior problems or many
exactly.
other things. You never think that that could be the source. So, what do you think is the main message you want to bring to the public today?
Honestly, we really need to stop treating symptoms and start looking at the root causes. This is what I want them to do, to look at root causes, find out why we be showing these symptoms. If you're grinding your teeth, constantly tired, moody, or your child is having trouble sleeping or behaving, it's not just a phase or something to ignore. There is a real possibility that sleep disordered breathing or an underdeveloped jaw is involved. Sleep apnea isn't rare. It's just underdiagnosed, especially in children. And what breaks my heart is that many of these problems are easily fixable in kids, yet they go unnoticed until adulthood, and when the damage is harder to reverse. Some kids get diagnosed with ADHD and start taking all this medication for it, while it's just simply symptoms of undiagnosed sleep apnea and can be easily resolved. My message is simple: early diagnosis, holistic awareness, and airway focused dental care can change lives. You don't have to live exhausted. You don't have to just deal with it.
Mhm. That's great. That's great news because that's a lot of times that's what doctors will tell us. We have to deal with it. We have to live with it. It's chronic. It's for the rest of our lives. So that's
Exactly.
fantastic news, Dr. H.
Thank you.
So let's talk a little bit about how difficult is this process? You said it's easily reversed in children, and what does it entail?
For children as young as 3 years old, we can give them a piece of plastic, like a block, we call it a block or guide, that guide their growth. So they place in their mouth, it has a specific design, it keep the mouth closed and bring the jaw a bit forward. So the reason we are not breathing at night mostly is obstructive sleep apnea. And obstructive sleep apnea is because soft tissue kind of like obstructing the airway, and especially if you are underdeveloped, so which most of us new generations are with a Western diet. So what it does, it brings the chin forward and it helps the kid to be able to breathe through the nose during the night, which nose breathing is extremely important. Now, this also make the tongue to come up and play with little tongue place we have, so that kind of like um, help the tongue to stay up, which is very important for expansion. And on the top of that, when they clench, they expand. They don't damage their teeth. They actually expanding their jaw, but basically very naturally, and we mimic the natural thing that they're supposed to chew on hard stuff, but unfortunately they do. So that's the easiest thing we can do for 3 years old. And as they grow, we change this and we have them to practice on it 1 hour to 2 hour a day and wear it at night. And for some cases that are extreme narrow, we can place a very simple, easy expander that which is fixed, and then we only need to turn it once a week and then we remove it. That helps very, very effectively.
Okay, fantastic. Now, what about for adults?
For adults, we have two ways to go. We have one is to manage the sleep apnea because the damage is done. And to manage the sleep apnea, there are devices again to bring the jaw forward and help the jaw stay forward and doesn't block the airway so they can breathe better. Um, So of course, there is a medical way, the CPAP, that most people are aware and familiar with it. Dental wise, beside that device, we have some newer stuff, and these are FDA approved. They can actually expand adults' jaw,
Wow.
even though, yeah, the philosophy is that they cannot expand, but they do. We do expand, no matter of the age. However, that's slower, and that device is removable,
Mhm.
and we need to wear it at least 12 hours, so 8 hours at night and extra 4 to 4 hours during the day. But it works. It's just a little more work, and it takes like a year or so.
Okay, awesome. Very good. That's fantastic news. So what advice do you have for parents who are having children with behavioral issues that are exhausted all day even though they slept at night? What what can they do?
What I strongly recommend to watch out for some symptoms on the kids. So, what are them? So if the kid grind a lot, so 5 years old kid doesn't have a stress, so there's no need the stress causing this grinding. So there's something more going on, and actually it is a stress, but it's not a mental stress; it's a body stress. So their body needs oxygen. They are not breathing well.
Mhm.
Now, for people who are not familiar with OSA or obstructive sleep apnea, um, that means that during the sleep, for a period of time, the person doesn't breathe for a few seconds. And what happened is that because this is that the airway get blocked or clogged, and while we are in deep sleep, we don't realize it, so we stop breathing, stop, and all of a sudden we, you know, open our mouth to get the air. So we grasp air all of a sudden. So if we keep doing that, breathing, stop breathing, breathing, stop breathing, what happened to our sleep cycles? They get interrupted.
Hmm.
These are all arousal all the time. If we don't go through our sleep cycle, what happens is that the sleep is not restorative anymore. When the sleep is not restorative anymore, especially for children, the growth and develop, it all depends on that sleep.
Hmm.
Either it is about the cognitive brain or it's the body. So for adult, it's the same. We need to rejuvenate. We need to restore
Yeah.
and our memories and all this. And that's why early Alzheimer is one of the problem that comes, unfortunately, for adults who don't breathe well and they have a sleep undiagnosed sleep apnea or they don't do anything for it.
Wow.
So for children, signs and symptoms is like grinding hard, or they could have bedwetting. When they can't breathe, their body don't wake them up like us to go to the bathroom. They just wet themselves. So bedwetting, nightmares, and also grasping air time to time, like quiet, all of a sudden they
Yeah.
do that. You
Okay.
can see that. So watch your kids because 90% of people who have the kids that have sleep apnea, I asked their parents, how's the sleep? They say like, oh, the kids are sleeping well.
Right.
But when I tell them and then I ask them to actually watch them, next time they have different stories.
Right. Right.
So yeah, these are the things along with, keeping like not concentrated. Sometimes they get hyperactive and sometimes they are very like low in energy. So these
Right.
are the things that we should look at.
Okay. Excellent. That's really good information. Thank you. So let's talk a little bit about authenticity since the show is called Dare to be Authentic. What kind of role does that play in what you do, Dr. H?
So authenticity is everything to me, honestly. I don't offer treatment that I don't believe in. And in my case, I actually have lived through this problem. I have seen how transformative these appliances can be, not just as a dentist, but as a father, as a husband, and a patient myself. So patients can feel when you are genuine,
Yes.
they're tired of quick fixes and being rushed through the appointment, which we are all familiar with. I want them to feel seen, heard, and understood. The most authentic I am with them, the more trust we build.
Right.
And the trust is what leads to real healing along with believing.
Fantastic. And that's so true because, and there's nothing, for me, there's been nothing worse than going to the dental office and you have your x-rays and then they give you this long list of things that need to be done and the warning, and this has happened to me more than once and I knew it wasn't true, that if this doesn't get done your whole jaw is going to collapse. I literally had a dentist tell me that and I was like, oh, I don't belong in this place. I said thank you very much and I left. So I love that because nobody wants to be scared into something rushed like you say, and I love that you say that people want to be heard. They want to be heard and seen. That's so true. And I'm so glad that you do that for your patients. That's fantastic. So, other than the sleep apnea, what are other main ways that you help others?
Well, I offer things like digital implants. So we have CBCT, which is kind of like MRI for the jaws. So we do that, and then we scan. So I have all these equipment that I need to work with, and we create a guide, and then the guide helps to place the implants accurately. So we design everything ahead of the time. We know how much bone we have,
Hmm.
and then that has the least discomfort for the patient, the least amount of surgery, the least amount of bleeding. Um, I had this patient who was very scared of sinus lifting because the sinus was low and didn't have enough bone to place an implant. I told her, I assured her, like, this is not a big deal with the new technology. It's really not a big deal. So she came in, I placed the guide, I lifted sinus in 5 minutes.
Oh, wow.
5 minutes. Place bone, place implant, all together. It was like about less than 10 minutes. And she was shocked. It's like, that's it? Yeah, that's it. And no bleeding, no nothing. So this technology really helps. And I also do veneers and clear aligners and full mouth reconstruction for people who have a lot of problem with their teeth. But honestly, my deeper goal is to restore function and peace. For some patients, that means no longer waking up with headaches. For
Right.
others, it being able to eat without pain or finally getting a full night rest. I also help by educating. Many people have no idea that their fatigue, their snoring, their child's ADHD-like symptoms might be linked to airway issue. So I take the time to explain, to guide, and to offer hope. My care is not just technical, it's personal.
That's fantastic. Very good. So let's go back to the sleep apnea and talk about an adult patient you've had good success with.
So for adults, what we do, first of all, in office we have a ring. So it's just like a ring. It goes to the index finger, and they go home with it, and we can test their sleep, right?
Oh, wow.
So yeah, it's really that easy, and that is an FDA approved actually device. The result comes online, and I can see them, I can read them. I can't diagnose them with anything, but I can read the result. For actual diagnosis, we can send them to the uh, sleep physicians, and they read the same result and give the final diagnosis. But that's beyond the point. So at least we can see it because I don't charge much. It's just whatever I charge for the reading. This is not for profit. This is just for to see actually if the patient has a sleep apnea. Then the next step, or if they know already they have a sleep apnea and they cannot tolerate CPAP or they do not want a CPAP, we go ahead and offer them either fix them for life or just manage the symptoms, which that's MAD device we call it is mandibular advancing device. So we bring the lower jaw forward and helps them to stay open during the night and being able to breathe. Now that also helps snoring. So
Wow.
snoring and sleep apnea are kind of related.
Hmm.
Not necessarily everybody who snore has a sleep apnea, maybe to some point, but not like important enough to do something for it. But loud snoring usually is related. So usually because the same cause, which is soft tissue clogging the airway, is for both, so the causing both, like the snore and the sleep apnea, caused by both reasons, same reason. So the MAD works for them too. Now, there are adults that wants to get to the root cause and they really want to get rid of it altogether. So we place them on devices called DNA, day and night appliances, or mRNA, which is the upper lower connected and bring their jaw forward. But meanwhile, they get expanded. And this expansion is just like the children, they need to turn it weekly, except for children is fixed, so the children doesn't cannot take it out. For adults, they can take it out during the day, they can speak normally, and then put it back on during the evening or night or on lunchtime. And that little by little growth cause growth. So again, the main reason behind the sleep apnea is small airway. The main reason behind the small airways is underdeveloped jaws. So when the jaw develop, they come out. when they are back, they easily clog or block the airway. So with this, we expanding them. We're helping them to expand. And sometimes when the upper jaw expands, the lower jaw follows. And they both get larger. And even 1 millimeter sometimes help tremendously. So bring the patient from moderate sleep apnea to mild sleep apnea.
Wow.
So that's another way we can go about. This takes longer, but it's more effective, and most of the time it's done. Like after that, they don't need to be worried about the sleep apnea.
It's fantastic. So why are our jaws so small? What's causing this?
Exactly. Beautiful question. So Dr. Crocini is a doctor who was a dentist who researched and went to isolated tribes and looked and noticed that these people all have perfect jaw, no crooked teeth, all four wisdom coming out, and they never have issue with this problem, with the crooked teeth problem. So he looked and searched, and the only thing he noticed is different is that they breastfeed their children to 2 to 3 years full, and then after that they give them hard food to chew on, like beef jerky.
Wow.
So then he noticed that one of these tribes who the Western culture kind of came into, and they got introduced to soft food and all this stuff, and then only after one generation, 50% of these children had crooked teeth. One generation.
Wow.
2 generations, 70%. 3 generations, 90%. The genes take 20,000 years to do that mutation to cause this problem if it wanted to be a gene problem. But that's environment. So that is the reason that we have all small jaws, because our nutrition is not good, our tongue is lazy, and it cannot expand our jaw. And we just feed kids with this little pacifier or bottles that are easily drip the milk. They don't need to try to do that, to suck the milk out. While for the breast, they have to work for it.
Yes.
And it also expands their jaw. And then after that, they chew, and they're continuously doing this. So now this is how we are helping the children, kind of mimicking this situation. We give them this block and put them in their mouth, and then by kind of chewing on it and at night actually grinding on it, they kind of help their jaw to grow. And that's why they call them guide. It guides them to grow properly. And usually, if they do that for a few years, they don't even need ortho. Wow. So that's why, unfortunately, most of us have some way, somehow, a smaller jaw and maybe mild, at least a mild obstructive sleep apnea.
Yeah. And so once that jaw is expanded, it doesn't go back. It doesn't reverse, right?
Usually don't, yeah. Yeah. So when the jaw gets expanded, because there is two different things. We have teeth expansion, we have jaw expansion. Teeth expansion, because we are pushing teeth where they don't like to go. If we don't put a retainer, they come back. But jaw expansion, when you create that bone, now the bone is large, so there is no way to bring it back. However, there are some wrong way to do this. If for kids, we place them on rapid expansion. So that rapid expansion means every day or every other day they turning. So a quick expansion. What it caused, on the middle of the upper palate, there's a suture. That suture get opened quickly, and it doesn't have time to create bone in between the suture.
Right.
So it creates some tissue, but it's not really bone. When the thing come out, the expander, it relapse. So most of the time for these cases, we have a lot of relapse. That's why for kids, it usually take about 9 months to have this 1 week turn And so the whole process takes 9 months. So that's way more effective. When it comes out, of course, we place guide after that
Right.
to help, but usually it's enough bone that it doesn't relapse.
Fantastic. That's great. So we have probably about 6 minutes left. Is there one last thing you'd like to say to listeners? Something really deep on your heart today?
Of course. So if you're listening to this and something in your gut says that, oh, that might be me. Oh, that might be my kid. Please don't ignore it. You're not overreacting. You're not imagining it. You deserve answers, right? You deserve answers. And more than anything, you deserve peace, peace of mind, peace at night, and a life that's not ruled by exhaustion and pain. So whether it's for you or your child or someone you love, take the first step. Healing doesn't start in a textbook. It starts with being open to change and trusting someone to walk that journey with you. So I say it again, healing doesn't start in a textbook. It starts with being open to change and trusting someone to walk that journey with you.
Yeah, so true. Being open to change is so important. And I would say doing it even if you're scared, because there's always fear in doing something new. And I love that you said earlier that you are there to guide your patient, like that one lady you talked about that was so scared about the implant, and say it's going to be okay because we need that. If things are scary, especially going to the dentist, can be very scary sometimes.
Very true, very true. So I had this older lady that was really scared, has a lot of bad teeth, and because of pain came to me and had one teeth out. But she started like trusting me,
Hmm.
and then I told her to come back, let me check other teeth, and I told her to look with this teeth, even though there's no pain, you are in trouble. You need to chew because chewing helps the cognitive to stay, uh, basically it helps their cognitive, it helps the memory. So not being able to chew actually could lead into early Alzheimer as well. So
Oh,
so she trusted me. She said, you know what, I trust you. So she came back and she got everything done and she's very happy. So it is about the trust. If we don't take our time, if we don't really listen to the patient and see what's going on and just rush through things and give a list of treatment, as you mentioned, to the patient, it's like, hey, the front desk will talk to you.
yes,
So
exactly.
that won't work.
Yes, I heard
Exactly.
that way too many. The front desk will talk to you. That's fantastic. I just love what you're doing. I love that you have such a passion for this. Where do you think that passion came from?
Look, that passion came from that personal experiences. Like, as I mentioned at the beginning, I, I was interested in dentistry always, but when I went to dental school, we learned a lot. Okay, that's great about teeth and how to manage the pain and all this stuff. And then when I came out and started practicing, I noticed, hey, look, there are a lot of stuff beyond the dental school that I need to learn. So I went to the Dawson Academy and I got my mini residency, and then I got introduced to the sleep apnea, and I wanted to know everything
Hmm.
to perfect myself. And that was eye-opening when I went to the we was an institute that is for sleep institution. So I learned so much that I cannot unseen this stuff that I saw, and
Right.
I learned. So as I mentioned, I was my own first patient. I noticed that I had a sleep apnea. I feel way much better now, and more energy. And then my daughter, and then my whole family, and then patient that I could see how I can change their life and their family's life. That's where my passion is keep getting fueled.
Mhm.
It's not just one time thing.
Right.
Uh, when I hear the feedback, that's where my passion gets fueled every day, and that's what we need, something to help us to keep our passion up.
That's so true, Dr. H. Well, we are out of time. It is so wonderful to have you on the show. It's been fantastic. So much good information for the listener. And thank you for listening in to Dare to Be Authentic podcast. This isn't going to be available indefinitely, so spread it to people that you know that are having trouble sleeping or have headaches or all these other symptoms Dr. H has talked about. And we'll see you next time. Bye for
Thank you, Mari. Have a
now,
wonderful day.
Dr. H.